go. Well, good morning, Queensland. Sadly, I'm reporting today 16 deaths as a result of COVID, the highest number that we have seen in a single day in Queensland since the pandemic started. This is 45 deaths now since the 13th of December, and I know the Chief Health Officer and I want to emphasise that of these 45 deaths, only one person has had a booster shot. And if I can implore anyone out there to do anything today to prioritise getting your booster, particularly if you are elderly and vulnerable, please come forward and get your booster. We know that it makes a difference. We've had 15,962 new cases, including 5,984 rapid antigen test results registered. And thank you again to Queenslanders coming forward and registering their positive tests. We've done 32,506 tests overnight, and the number of people in hospital is 819 patients now with COVID, 50 in ICU, 32 non-ventilated and 18 are ventilated. Our vaccination rates are sitting at 91.59% for a single dose and 88.72% fully vaccinated. And it's great to see our 5 to 11-year-olds continue to increase. We're now at 14.03% of eligible children have had one dose. That's 67,155 5 to 11-year-olds. And we've had 968,907 boosters as well. But that's still only around 56.5% of the eligible population who are due for their boosters right now and have not got their boosters. So please come forward. If you've got an elderly person in an aged care facility, family member, ask the facility when they can get their booster. If they are able to be taken elsewhere to get a booster, instead of waiting for someone to come to the facility, take those opportunities because that booster counts. I can also advise today that we will be changing the rules around visitors in hospital settings. This will limit the number of visitors at any one time to 2 people in wards and 1 additional person in addition to the patient themselves who can attend in an emergency department. We have had some reports from hospital and health services that they're seeing large groups of family members coming into the emergency department together, and we really need to reduce the number of people coming into our EDs and moving around our wards at the moment. We're not putting a complete ban on visitors as we did have to do previously, but we are limiting the numbers. Of course, there'll be exceptions to that rule, particularly around palliative care, end-of-life visits and maternity. I do want to also emphasise to people, we are seeing a bit of a delay in people coming forward for their second doses, particularly in that 20 to 39-year-old age group. We know many of these people in this age group are the ones who are becoming positive with COVID. I want to be clear that if you have had COVID, that there is no reason to delay coming forward for a vaccination, whether it's a first, a second or a booster, as long as you have recovered from your symptoms. There is no reason to delay coming forward for that vaccination. I believe there may have been different information given previously about waiting a certain period of time after you've had COVID before you get vaccinated, but that's no longer the case, and the Commonwealth is advising that you can get vaccinated as soon as you have recovered from your COVID symptoms. So please keep coming forward and getting vaccinated because your natural immunity will not be enough. You do need to get your vaccination as well. And I do want to talk about our 12 to 15-year-olds because we have seen a slowing down of our 12 to 15-year-olds getting vaccinated. We had a great surge, many parents coming out early on to vaccinate their teenage children. But I remind everyone, as schools are going to open in February that it's important that all of our school kids get vaccinated, not just the 5 to 11-year-olds. Currently, 73.27% of our 12 to 15-year-olds have had one dose and only 65.81% 2 doses. Now, I'd like to see that figure much higher as these young people, our teenagers, look at going back to school in the very near future. And lastly, can I say I've seen the ads that the federal government is running, that there are free rapid antigen tests at public testing clinics available to anyone who is a close contact or has symptoms or required to undertake a test as under a public health direction, and talking about the number of rapid antigen tests that the Commonwealth has secured to support that free delivery. Queensland has not received the Commonwealth supply yet. In fact, it's due tomorrow and only 100,000 are coming to us tomorrow. 50,000 of those are point of care tests that are not really suitable for our public testing clinics. I think those ads are very self-serving, they are highly political, and it's about Morrison positioning himself to look good in the lead up to an election. To actually be running these ads knowing that there is not enough supply at our public testing clinics to give everyone who turns up with symptoms or is a close contact a free test is, I think, irresponsible. It is not Scott Morrison who is standing there at these testing clinics having to deal with the abuse of people who are unhappy because they can't get a free test. And to run these ads now, knowing this, is just, I think, absolutely appalling. And Scott Morrison should be apologising when he knows that supply is not available right now. I'll hand over to the Chief Health Officer and then we'll take questions. Thank you.
Sadly, we have 16 deaths to report today. 3 people in their 70s, 8 in their 80s, 4 in their 90s, and 1 person aged over 100. 4 of them had not been vaccinated, 2 had 1 dose, 10 were double vaccinated, and none had received a booster. Of these 16, 9 were from residential aged care facilities, and we're thinking of their family and friends today. Again, I would remind everyone that of the 45 deaths that we've had in Queensland so far, since the current wave, which began on the 13th of December, only 1 has received a vaccine booster, the 3rd dose. Only 1 has received the 3rd dose of vaccine. And the virus does seem to be finding older people who have not received that 3rd dose. In terms of the current status of the pandemic in Queensland, particularly with regard to hospitals, we now have 819 people in hospital with COVID-19. That's a substantial increase from the previous 24 hours when it was 702. I would guard against reading too much into that substantial increase. We often find that numbers on a Monday are higher than on other days because of lags in discharges over the weekend. That's a common phenomenon in hospital, that Mondays tend to have higher numbers. So I'd wait before making anything too much of a trend. I think we should wait for another couple of days of data. But clearly the numbers are going up. There's no question about that, and that is what we've been predicting. We're heading towards our peak that is still projected to be towards the end of this month. So of the 819 people in hospital, that includes 50 people in intensive care, of whom 18 are ventilated. Monday, that was 47 on Monday. So 50 currently in intensive care, 18 of whom were ventilated. The virus is very widespread across Queensland. Areas which are increasing in numbers include the entire metropolitan Brisbane area. There's quite a bit of activity in Ipswich, which is causing pressure on Ipswich Hospital. Also significant numbers of cases in Cairns and of course the Gold Coast. And I just to reiterate what the Minister has already said, the Commonwealth guidelines indicate that if you have caught COVID, that is not a reason to delay vaccination as long as you've recovered from the illness, whether that be your initial vaccination boosters or the third dose. I'll now hand back to the Minister.
Minister, can I ask, I understand some tents have been set up in construction near the Gold Coast Uni Hospital in Ravina this morning to help triage patients before they go to EDs. Is this happening anywhere else? Can you explain, I guess, more?
So we did have that happening at Ipswich a couple of weeks ago as well. Some of it's just overflow and making sure that we do not have congested emergency departments, so they're using it as a safe waiting area as they triage people. We want to make sure that we can have that sort of space and social distancing as much as we can in our EDs. It's part of the reason why we are limiting the number of people who come in with patients in ED, so we don't have whole families of 5 or 6 people sitting there with the one person who actually needs treatment. It's really important that we do implement these measures just to ease some of those pressures in our EDs.
On that, at Ipswich Hospital, staff there have told me that there's 5 wards which have COVID patients in them, which have 5 wards which have COVID patients in them. There's only one negative pressure ward, which results in naturally COVID spreading throughout the hospital. So how much of that is a concern at Ipswich Hospital, and how much is it a concern in other hospitals around the state?
Yeah, look, and as I visited around the state last year, I know, so many hospitals have negative pressure rooms set up, but there'll never be enough negative pressure rooms to put every COVID patient in when you start having transmission so wide in the community. But we do have all the infection control procedures in place to limit any spread outside of COVID wards into other areas of the hospital. But we have to remember now, every single person walking into ED, anyone who gets admitted via an emergency, coming in by ambulance, for some other reason, someone who may have been having a Category 1 or 2 elective surgery, could end up showing up positive while they're in the hospital system, no matter what ward they're in. This is what we plan for, this is what we expect. It'll be less about individual COVID wards and more about just treating the COVID patients as they arise, and certainly moving them into areas together to try to reduce the spread in the community or into the hospitals.
On behalf of those tens of thousands of parents who had to make new plans with the delay of school return, what would you say to those who are asking who runs the state, the government or the teachers?
The fact is that the Premier has made it clear she will do what is right for protecting our young people and importantly protecting our teachers, staff and the spread of this virus. We know, we've taken this on advice from the Chief Health Officer. The Chief Health Officer has made it very clear that if we were to send all these kids back to school, when was planned, the 24th of January, we can see major super spreading events because we know young people spread the virus quickly, and that would spread through the teachers and the school staff, and also it will spread into households. This isn't just about teachers. Have a look at the Indooroopilly cluster. Those children took it back into households, and we had very large transmission in households of those children. Now, if we want to reduce the spread in households so that we have more people going to work and supporting the economy, then we need to make sure we're doing what we can to reduce those obvious... Well, I am answering. I'm answering it.
The success of the union in demanding the removal of that extra week's schooling for tens of thousands of children. How did they succeed just a week? Someone senior in the education department advised the government to tack that on to the end of the school year. Why?
My recollection at the time, as Minister Grace said, we're looking at extending the school year by a week, and we'll work with the teachers and the teachers' union about how best to do that. I am very pleased that the profession has been able to find a way of working that curriculum and that learning into the school term so that that is not needed. There's nothing wrong with that. That is sensible, and I'm sure that parents welcome that.
Why is it such a good idea a week before that?
Sorry? It's the one piece of paper I didn't bring with me today, but I can give you those numbers shortly. I haven't got the breakdown. We're looking at around anywhere between 4,000 and 5,000 staff are furloughed every day currently in the health system, both positive and those in close contacts. As of yesterday's figures, I think we had about 150 of those close contacts have been called back to work and to assist in those hospitals where we're seeing the largest number of cases, including the Gold Coast. Sorry? Oh, look, I'm concerned about the situation everywhere, but we do know in aged care they're the most vulnerable. I'm hoping to the health ministers normally have a meeting prior to National Cabinet. I'm hoping that I will get the opportunity at that meeting to raise with the Commonwealth again how quickly we can get these boosters into these aged care facilities. It's absolutely paramount. I know that some of the in-reach that the Commonwealth has been doing, there hasn't been 100% take-up of boosters, and I want to know why. I don't want to hear that only 2/3 ended up taking up a booster. Are we not messaging properly? Are we not communicating with the residents? Are we not communicating with the families? Why is it there isn't 100% take-up of the boosters? Because what we know, last year we were talking about this virus finds the unvaccinated. Now we can say Omicron finds the elderly who haven't had a booster, and we need to get them boosted. Yeah, so there's, I believe, around 108 of those across the whole of the QAS. And of those, none are on special leave. If they are on leave, if they're on any paid leave, it's their own leave. No one's being forced to take sick leave or annual leave or long service leave, but they may have accessed their own leave while they consider their options of whether they're going to get vaccinated or not, but none of them are on special leave. That's right. That's right. They're accessing their own leave. They're not getting special leave. Well, if you have a look at the ad, there's a lot of chest beating there. It is the Commonwealth who is boasting that they've ordered millions of dollars, secured were the words I think in the ad, secured millions of tests to assist in providing these free at state public clinics. I think that's a bit rich that the Commonwealth are spending money, taxpayers' dollars, running ads about what the state public testing clinics are providing. We're the ones doing all the hard work here. We're the ones every single day dealing with this virus and the spread of it across our state and trying to keep our population safe. And I think if you're going to spend money, spend it on securing more tests for us and listening to the GPs, the aged care facilities who want them quickly, and all the essential workers and those businesses. Do something in that space if Commonwealth wants to do something, not run self-serving ads about how they can come to our testing clinics and get free tests when they haven't even been provided yet.
I can only talk for Queensland Health. Queensland Health facilities do not have a problem with supply at present. So I can't talk for the private sector, I'm sorry. I really am not aware of the supply problem in general practice. That's news to me. I don't know about it. We're not involved in the distribution of vaccinations to general practices.
I'm happy to address that. So supply of vaccine to pharmacies and GPs. Yeah, and that's the Commonwealth's responsibility. They're dropping the ball at the most critical time. We need vaccines in arms. We need the 5 to 11-year-olds vaccinated. We need the 12 to 15-year-old vaccinated. And most importantly, we need the elderly people getting their booster. And it should not be a supply issue. We have heard from the Commonwealth time and time again, there is no issue with vaccine supply. So why isn't it getting to the GPs and pharmacies quick enough? They need it now, and they shouldn't have to be cancelling bookings. And when it comes to aged care, again, this is a Commonwealth responsibility. And it's not about passing the buck, but this is about our health workers are busy in our hospitals trying to save lives. The Commonwealth has a responsibility to get those vaccines into aged care facilities and disability facilities. That is their job, and they need to get on with that job and look after these most vulnerable in our community.
Just back to Queensland.
Yep.
How can the public be convinced that this government, your government, has an efficient cross-government approach towards COVID when your own Chief Health Officer admitted yesterday he has no idea about the number of unvaccinated teachers? Why isn't someone from Education briefed his department on the extent of that potential problem going back to school?
It's not a problem. The Minister for Education, Minister Grace, said yesterday that she had very high rates of vaccination across teachers.
No one seems to know how many are unvaccinated.
The Chief Health Officer didn't have the figure in front of him yesterday, but to say that information's not shared is just not accurate.
Something on which you'd like to see improved?
The Chief Health Officer can be provided with that information on any given day, any given time. But to be honest, that is not something that the Chief Health Officer needs to get preoccupied with on a daily basis. It is about the health advice and what we're doing in the health system and reducing the spread of this virus as we move into the surge and the peak that we're going to be facing. It is not for the Chief Health Officer to be reaching into education and asking operational questions about how many are vaccinated or not. That is education's job to do that. The Chief Health Officer has issued the Public Health Directive. It is up for each agency to implement that, and they're getting on with doing that. And it's just not, there's no silo at all. It's just not an accurate statement. Sorry? Yeah. Look, it still serves a very important role right now because it is the way that businesses can check someone's vaccination status. We still do monitor also whether there are super spreader events, and we know that data is readily available if we have a super spreader event at a particular venue. We've seen what has happened in interstate with nightclubs and whatever else and big super spreader events. So that data is still there. It's still available when we need to actually, and the website clearly says where there is a major super spreader event that we will put those sites up. But the vaccination status, for no other reason, that's a pretty critical reason why the QR code is still really important. Look, there's certainly been a decline. I see it. I feel like sometimes I'm the only one checking into places when I walk in. But I do remind people it really is important and it's in your best interest. It's simply about trying to protect people and to be able to advise them if there is a major outbreak in a particular venue that we can let them know. Sorry. Yes, so we distribute them, once they come into our distribution centre, we'll distribute them to the hospital and health services. who will send them out to the individual testing clinics, and how many of those will go to a public clinic versus those that are used within the health system, because that's another thing that the Commonwealth has also said these can be utilised within the health system as well. But I've said this before, half of what we're getting are point of care tests. These are not tests you can hand over to someone in a line on a public at a public testing clinic and they take home and do the test. So only half of these are going to be helpful as far as providing a free test to people. My question is, are these tests approved by the TGA? If they're not, then there's no point having that conversation. And if Tom Tate's got access to a ready supply, he can pick up the phone and we'll have the conversation. But I'm not going to just hand over money to Tom Tate. We'll hand money over to suppliers for the tests, but I'm not just handing money over to Tom Tate to provide them for us.
When are you expecting to finalise who will be staying at Wellcare? Will it be this week, next week, and when exactly do you think it will open to international arrivals?
I can say we're having a series of meetings over the course of this week. Finalising it, I can't tell you exactly when it will be finalised, but go ahead.
Do you think all 1,000 beds will be required?
I don't think it's speculative. It's a good facility to have. It's a good resource to have, given that we don't know exactly where this pandemic is going. I can tell you that I think it's we've had 45 deaths in this wave since the 13th of December. 22 have died in hospital, 17 have died in residential aged care facilities, and 5 have died at home. I'm waiting for information on one more. That's the breakdown that we have so far. Not that I'm aware of. I don't believe. In terms of deaths, I think the answer is no. I'm pretty confident the answer is no. Well, the single most important thing is to get vaccinated. I mean, this virus is throughout all communities in Queensland. So the vaccination is the single most important element, and that's where we are applying most of our resources. There are public health staff in all of these areas as well, but the single most important thing is vaccination. That's the nature of the virus. It is extremely contagious. It is everywhere. One of the problems is some people have very mild symptoms, aren't aware they're carrying it. That's a very common scenario. It's very hard to stop, particularly for a virus that is so contagious. So the focus really needs to be on vaccination.
Victoria, I think, released some figures this morning saying they're expecting hospitalisations to be in the thousands in coming weeks. Do we have a figure or an estimate on what Queensland will be?
We are planning for numbers in the thousands. That's what I would say.
Look, I'd have to get back to you. Those conversations would be had with the Premier's office and State Development, I would think, and certainly Minister for Trade as well. So happy to follow up and see what assistance. It's a sad situation, really sad situation, and hearing about that death overnight. And I just hope that the remainder of people are all accounted for, and Australia, I have no doubt, will do their part in supporting the community in Tonga. And I know there's a lot of people, including in my own community, who are Tongan, who have family there and are still waiting to make contact. There's difficulty with telecommunications, and they're still waiting to hear family. So I know it's a really distressing time right now, and our thoughts are with everyone in Australia as well who have loved ones and family and friends in Tonga. Thanks.